Hello, my name is Ana Carolina Victoria, oculofacial plastic surgeon at the Center for Excellence in Eye Care in Miami, Florida. And today I have the honor of interviewing Mike Saad, CEO and board member at NuLids. Welcome. Thank you so much.
Carolina.
Thanks for sharing time with us. So, Mark, you have this very innovative product, and we kind of discussed it a little bit before sitting down tonight. Why don't you tell me about NuLids, how it came about, and how we're embracing it in the market?
Absolutely. So I personally came from the outside world. I was in New York City, Wall Street for a long time in healthcare investment banking. So working with larger healthcare companies, a lot of medical technology and life science companies for 12 years. Then I went to the West Coast to be part of an executive management team at some life science companies as well. Always wanting to get into innovation and becoming part of, taking a new idea and making it something. So that was always my dream. Eventually I became a partner with a venture firm in San Diego, and we found the founder of NuLids, who was an ophthalmologist, a corneal specialist, a surgeon. And about 10 years ago, he was part of a wave of doctors that really appreciated how important the eyelids are. So when we think about the eye and eye health and ocular wellness, the eyelids, we all know now with, everyone talks about it much more, how important the eyelids are and the glands that are inside the eyelids, the meibomian glands. So that's something that is prevalent today. Well, 10 years ago, that was still kind of new when it was figured out that it was maybe 90% almost of the people that get dry eye. It's more about the meibomian glands not producing oil or it being blocked. It's more about tear retention. So these are important issues. So Dr. Olkowski felt that he could help his patients if he could get them to do better proactive ocular wellness. And the products that were available in theory work, but nobody uses them, like lid wipes and things like that. So he originally invented NuLids to be effectively an electric toothbrush for your eyelids. That's both very easy and comfortable, but it caused there to be a much greater compliance. So for his dry eye patients, it works incredibly well. And so that's how we originally developed NuLids, to be a product that any practice could sell to their dry eye patient. And it was incredibly successful. When I stepped in to run the company during COVID, I realized that it was still a bit of a foreign concept for so many practices. This whole idea of, the eyelids and sending it home.
Well, it's been the whole dry eye revolution and how you treat dry eye, right? Like, there's been this boom of different ways that you can address the patient's dry eye symptoms.
Right.
And it's about compliance, right? And having an effect that the patient can feel, right? Like, is there a symptomatic effect? So I find NuLids very revolutionary because it's giving the patient power in a way that it's almost like you're making it part of your daily routine, right? By this toothbrush extension, I guess. So tell me more about that.
Absolutely.
How does that work?
So it's doing three things, right? So it's like when you think about eye drops help in the moment. They help make you feel better in the moment, or maybe some of the great drops help longer. Well, the idea here is let's have a more sustained benefit for the patient. So one is you want to clean the lids of all that biofilm and material that's blocking this oil that we talked about to getting into the tear. So it's blocked, just like if we don't brush our teeth for a long time, you get that biofilm on your teeth. Well,
I wouldn't know, but yes.
Our audience won't know that, but almost nobody takes care of their eyelids.
Agreed.
And so that biofilm and there's other material that now we know is largely caused by parasites, the Demodex mite.
Right.
So there's all this material that's really blocking the glands and also causing inflammation to the glands and hurting them over time. So so NuLids does is first it cleans very well, very comfortably, very quickly. Two, which is kind of exciting, is we've seen increased meibum production, and we believe the reason for that is that the oil that meibum is a certain type of oil called a non-Newtonian fluid, almost like ketchup. And when people think about ketchup, do you get ketchup out of the bottle by heating it or shaking it?
I squeeze the crap out of it.
Well, that's another way. A lot of people shake it.
But squeezing is more like the physical, right?
Yes. So we're actually getting the meibomian glands to work better.
Right.
And then lastly,
because you're mixing the contents then.
Absolutely. And then lastly, just like the patient likes the feeling of the NuLids massage, it's a very nice feeling. Well, it's a vibration action. It's a low speed vibration. It's not rotation. So that causes this vibration, and so it's like a massage to the patient, but like an earthquake to the mites. So we're seeing pretty good clearance of the mites for weeks, after a treatment. So it allows for people to treat themselves, or in an office setting in a very easy, routine way.
Right. And I think what's so important, and a point that you made, is that a lot of people and providers, physicians alike, just don't care much to touch the eyelid or the periocular surface. So if you go to your dermatologist, they'll do a full skin check and then they forget that there's skin on the eyelids, or they're just afraid of it, right? And as eye doctors, I think that it should be our goal to have our patients feel comfortable about how lid hygiene works, and how to make this more of a habitual thing, especially if it's going to cost them better function.
Well, this is incredible timing, because it was just in April that the medical editor of CRST, Cataract and Refractive Surgery Today, Bill Wiley, he had a wonderful article in April where he effectively stated that the ocular surface, the tear film, is inadequate. And he and the other surgeons, you're receiving patients that have poor tear film. It's affecting the scheduling of the appointment. It's affecting the measurements that you're taking. It's affecting the outcomes. And so this is all preventable in good preventative care if optometry and ophthalmology, whoever's doing the wellness visits, include some basic level of lid hygiene. So it needs to be very easy, very fast, very comfortable, and very inexpensive. Otherwise, it won't get adopted to the population. There's plenty of things that are very good and expensive. And there's many things that no one complies with. But if we can find that sweet spot, make something very efficient and practical and affordable to the patient, yet very easy and profitable to the practice, that's where we're putting that together. So what we're really excited about is bringing NuLids Pro to the primary care optometry ophthalmology.
Right. So let's talk about NuLids versus NuLids Pro a little bit, because there is two products that you guys carry, and one I think is more for the patient, one is more for the physician's office. And again, I think that it gives you a different level of effect.
Correct.
Right. It empowers, and I think it empowers both. Tell me more about that.
Absolutely. So there are only 1 out of every 20 people are diagnosed with dry eye. So about 16 million people. Per the Titan study, and I think we're going to have visitors here that were authors of the Titan study. It was Bill Trattler and Paul Karpecki and some really great names. They established that almost 60% of the population has diagnosable Demodex blepharitis, which is inflammation caused by the parasite. It's almost always not symptomatic, though, to the patient. So they don't really know what's going on. It's just that they have this inflammation damaging their eyelids and damaging their glands. So the idea is that everybody can benefit from some level of office ocular wellness. So the idea is the Pro is a little bit more powerful, a little longer battery, it's built to be handled around the office, and it uses different tips that are in a sterile pack so that you're going to give that patient their own experience. It's a stiffer tip that the lid hygienist, the technician, is going to perform. And then the idea is to make that routine. Every few months, the patient can just see the lid hygienist. We also have the at-home product, which is ideally for the patient that knows they have dry eye and they can treat themselves every day. So that's how we really distinguish them. And one of the beautiful things for the other companies and practices that really want to focus on advanced dry eye is, I talked about that 1 out of 20 versus 12 out of 20. How do we find the other 11 out of 20 that have dry eye but don't know it? So we found ways where you can use NuLids in the office, treat just one eye of the patient, and what they thought was fine, that other eye becomes intolerable. So now we can awaken them so that the practices don't have to feel like they're pushing advanced treatments. Instead, the patient becomes aware, so they become a much more receptive customer and engager to get advanced treatment. So I think we're doing something really special with the Pro not only to make the eye exam more valuable, not only to make the surgeries more successful, but to find all these undiagnosed patients that the practices that want to focus on dry eye can really serve them without feeling like they're pushing treatments on that patient.
Right. And I think also it's a great way to introduce lid hygiene to the younger population as well. We know that younger patients are using a lot of lash extensions and fake eyelashes, even the older ladies.
Well, they're on screens 12 hours, and we know the data connects between that screen time and blepharitis because they're not blinking.
Right.
So, but you're right about the lashes.
Yeah.
And we've actually shown. I was just saying, we just went to a lash convention to prove that not only can we clean these very challenging lids perfectly, but it's gentle, it won't remove the lashes. Right. That was an extraordinary realization.
Which I think is great, because if you're going to be promoting a product, you kind of have to, not detriment their daily life in however way they're. Awesome. So where do you see this going forward? I think, what model are we going to have to adapt to get this going?
Well, like any new company, we're figuring it out, but I think it's clicking now where we've got the two lanes. We've got, let's get more and more offices using the Pro for their primary care, and that's happening. And then, to Dr. Wiley's point, we need to have more frequent visits with the population. So right now, there's only 110 million eye exams done per year. So every other person doesn't even see the eye doctor. The person that does only goes on average every 18 months. From a wellness point of view, that doesn't do it. So how do we make that more frequent? So one way is the practices will just empower their technicians, which is exactly what's said in the article, to be able to provide these treatments proactively, very efficiently in the office, very affordably for the patient. So on one hand, we're going to have more practices adopting this new proactive wellness model, number one. And at the same time, that's going to surface more and more patients that become great candidates for our at-home product. So I really focus on the Pro, and the home product sells itself.
Right.
So our model, I think, is going to grow very successfully from that. And eventually, I think, like I said, I came from the venture world. I eventually think we'll be part of a bigger company, but we're not in a hurry. We can just keep growing the business and making this successful to the patient and the practice, and then see where it goes.
Well, I think what I love about this product is that I've seen it. I've had it at least touch my hand on my eyelids. I was wearing makeup. I'll get to use it maybe tonight. And I think, one, it's easily done, very tolerable. And I'm a bottom line kind of person, right? It's, from what I understand, pretty affordable for the physician and for the patient, right?
Absolutely.
And at the end of the day, you have to, as a provider, a doctor, optometrist, think about what kind of effect are you having in the patient's health and in the bottom line of healthcare costs, right? And not all of our patients can have access to a treatment that's $1,000 per treatment, and then they have to do 4 sessions, every month or month and a half.
Those are great, but not for everybody.
That is not super tolerable either. So I think that this is just something that you can really implement well, that will bring patient satisfaction quickly, and it's a instant reward, instant gratification.
For sure, we're getting the cost down to about $6 a treatment to the office, so they're charging under $100 with incredible patient acceptance to that. And you just mentioned something else really awesome, and it slipped my mind, but I think we're making it very accessible for everybody.
Improve health quality.
And you just said it. They feel better right away.
Yeah.
So that immediacy of the difference, when you can offer something they can see, feel, was affordable, they feel value for it, and the practices do extremely well with it too.
Yeah. Mark, thank you so much for sitting down with me in the hot seat at the Innovators Pop-Up.
Thank you so much.
Thank you for sharing your time.
Appreciate it. Thank you.